Watch this video to discover the truth about the 7 most common myths about aligners and see how they can benefit you and your practice. So let's start off by defining what are aligners. Aligners are a type of removable orthodontic treatment that puts pressure on teeth and moves them into the desired position. Myth number 1, aligners are not as good as metal braces. This is a super common myth, and honestly, it's very old and outdated. Back in the day when aligners first came out, they were not effective at moving teeth. Over the years, millions of dollars of R&D has been poured into clear aligner therapy, and today it is very predictable and just as effective as metal braces. There is a place for metal braces, and there are certain cases where metal braces will be more effective than aligners. But the opposite is true. There are so many cases where aligners are actually more effective than metal braces. Closing anterior open bites, for example, are super predictable with aligners and can be a little bit more challenging with braces. Solving minor crowding and minor spacing cases, also super effective with aligners, takes a lot longer to do with metal braces. Myth number 2, aligners cost more than metal braces. So, like anything in the world, depending on where you live, the price of aligners can change. Also, the price of aligners can change based on the complexity of the case as well. But on average, aligners are anywhere from $3,000 to $8,000. The cost of metal braces, though, can also vary. This is also dependent upon the type of the case, the length of the case, and who's doing the case, an orthodontist or a general dentist. But at the end of the day, you're gonna get a lot more flexibility and, honestly, compliance with aligners compared to metal braces. The reason being is that they're not going to have metal brackets and wires on their teeth, and the aligners are virtually invisible and they're able to still function in their day-to-day. Myth number 3, general dentists cannot do clear aligners. Right now, that's a myth straight up because I am a general dentist and I do aligners, and I've learned from general dentists and I've learned from orthodontists on how to do aligners, and there's thousands of general dentists out there that are trained and able to do aligners predictably. This stuff isn't rocket science. It's plastic moving teeth. You do have to undergo some type of training to understand core principles and fundamentals of moving teeth, but at the end of the day, you can learn it if you really want to. It's important to note that any provider, whether it's an orthodontist or general dentist who wants to do aligners, they have to take additional training for it. Myth number 4, aligners don't work on adults. This is a big myth because moving teeth is not just for teenagers. Yes, when you try to move teeth with teenagers, it can be easier than with adults just because when teenagers are growing, their bone is also growing in their jaw. You can do things like expansion a lot easier in a teenager than you can in an adult. However, you don't always need to do expansion to have a successful case with aligners, especially in adults. In adults, you can use aligners to treat cases like spacing, crowding, overbites, underbites, and even crossbites if you want. Honestly, aligners are way more effective in adults than they are teenagers, in my opinion, because of compliance. An adult is way more willing to wear aligners for 22 hours a day and stay regimented with the treatment. Teenagers are a little bit more prone to laziness and they may not comply because having to take in and out your trays every time you eat is another responsibility. Myth number 5, patients don't want aligners. Okay, this is total BS. Patients love aligners. If you are a dentist and you're doing a couple cases a month, I can guarantee you it's because your patients are telling you they want aligners, not because you're actually talking about it. There have been millions of dollars that companies like Align have poured into advertising and marketing aligners to patients directly. So the patients are already aware that this is a procedure that can benefit them. The problem is a lot of general dentists don't offer it. Myth number 6, it takes too long to implement. Well, I can say from personal experience, it takes very long to implement something in a dental practice if you don't know what the heck you're doing. So if that's you, that's probably why it's taking you that long. My recommendation is to arm yourself with education so that way you can get more confidence and belief in the treatment. Get yourself a mentor so that way you have someone to lean on in case you ever get stuck and have questions. And dive in headfirst to this stuff. Okay, myth number 7, cases always end in posterior open bites. So this myth is what every older dentist will tell you about aligners. And the reason is because when aligners first came on the market, remember how I said they weren't that effective? That wasn't the dentist's fault, that was the technology's fault. And so what happened is, let's say they were trying to intrude the mandibular anterior teeth, but the aligners didn't actually achieve all the movement that was planned. So what happened is that in the posterior, they got the movement that they wanted, but in the anterior, they didn't. This then caused the teeth in the front to come together before the teeth in the back came together. So what was the result? A posterior open bite, and the dentist got scared, so they backed off. But that's not the case anymore today. When you set up your cases properly and you get the movement that you're planning on getting, and you know how to troubleshoot if a posterior open bite happens to happen, you're gonna be just fine. Again, invest in yourself and education to learn how to do these cases correctly, and you won't have any issues. So there you have it. Those are the 7 myths that surround clear aligner therapy. Hopefully this video helps show you that aligners can be just as effective, if not more effective, than metal braces. If you enjoyed this video, please drill that like and subscribe button, but more importantly, share this with a dental colleague. My goal is to give as much valuable information as possible with fellow dentists so that way we can all be better. Thanks again for watching. I'll see you in the next video.